I'm Christy Dick. I work in economic development with 5 communities in southeast Alberta, which are the Special Areas, number 3, the MD of Acadia, Village of Empress, Village of Cereal, and the Town of Oyen. So I help to recruit physicians and work with the Big Country Medical Dental Board to see that through. There was the idea that we want a doctor, but zero marketing. Well, how would you get a doctor if you don't tell anyone you want a doctor? Or your community is exactly the same as everyone else's. How do we make this community an interesting place for one physician out of a million physicians? I did an assessment of the situation. So yes, we have this need for a physician. We need a plan. So I created a strategic plan around this. And in the plan we had some new things that hadn't really been done by many rural communities. So the use of social media, an online presence of our own. We weren't relying heavily on Alberta Health Services. And then we realized we need some extra cash, and we had been working with Kim McKinnon on physician recruitment. So that was another thing, I guess, in the plan, is that part of that was partnerships and how can we work better with Alberta Health Services, Rural Physician Action Plan, other communities within our region. And so then as we're looking at that, we realized, well, we need some more money if we're going to do some of these things. And that's when we applied for the Community Partnership Grant through RPAP. It was huge. It allowed us to get some extra contract resources. So we hired a social media company, Lorraine Pearson with Social Delight, and she was able to allocate hours specifically to our physician recruitment social media outlets, and that was just amazing. So she was able to connect with community as well as recruit doctors through that social media presence.
My name is Lorraine Pearson, and I am the social media communications gal behind Return to Rural and Physician Careers Oyen. With Return to Rural, we saw that social media was a huge success. So in strategies for working toward physician recruitment and attraction, that just seemed to be the answer. So with ours, if you go to our website or on our Facebook or Twitter, we actually have some really catchy marketing. And that's kind of what draws people in. Because say when you're running the Facebook ads, etc., when they see that really fun, catchy picture or phrase, they're going to be more likely to click onto it. And if that's how you're going to expose yourself, is through the World Wide Web, then you're going to really want to have something that gets through the noise of the rest of whatever it is that's on the internet. We were able to connect with our current Dr. Kin online.
I think Oyen is, for a rural town, punches its weight with regards to social network connectivity. I think the website for recruiting doctor was excellent, because I virtually could get all the information I required or needed to know about Oyen on the website. So it was excellent advertising. I could get all the information that I needed to know about working in Oyen. I could watch videos about the family physicians working here, what the people have to say, what the doctors have to say, what the pharmacists have to say. So pretty much all I needed to know about working here was available.
When we first started, we had lost 2 physicians. We had 1 physician in place, and we were able to get a temporary locum in for 6 months, and then she was able to add another 6 months, and then due to our recruitment and retention efforts, she decided to sign a 3-year contract. And then we recruited Dr. Akin specifically through the website and through our social media and the relationships we built. And so now we have we have our quota for physicians and 3 physicians in place at Oyen Medical Clinic. It's not just about creating a Facebook page to recruit a physician. That's not going to work. It's not going to work. You have to create a community. You have to respond. You have to create interest. We've worked alongside Dr. Akin, for example, this entire way. If he needs something, we're there. We're texting, we're calling, we're emailing. So we're there. And you have to close the loop on all of these things, and you have to continue to build relationships with the people that you're working with or recruiting. And without that, it doesn't matter what you do on social media or online. It's not going to resonate with people, and they're not going to become part of your community or buy your community. And there has to be a give and take on both those sides. That's what makes the difference, not just a Twitter account.